Treating vertigo. Treatment for vertigo depends on the cause and severity of your symptoms. During a vertigo attack, lying still in a quiet, darkened room may help to ease any symptoms of nausea and reduce the sensation of spinning. You may be advised to take medication by your doctor. You should also try to avoid stressful situations, as anxiety can make the symptoms of vertigo worse. Labyrinthitis is an inner ear infection that causes the labyrinth, a delicate structure deep inside your ear, to become inflamed. It's usually caused by a viral infection and clears up on its own without treatment. In rare cases, where labyrinthitis is caused by a bacterial infection, antibiotics may be prescribed. If you've experienced any hearing loss, your doctor may refer you to an ear, nose and throat (ENT) specialist or an audiovestibular physician. This specialist is a doctor who specializes in hearing and balance disorders. You may need emergency treatment to restore your hearing. Labyrinthitis may also be treated with vestibular rehabilitation, also called vestibular rehabilitation training or VRT. Vestibular neuritis, also known as vestibular neuritis, is inflammation of the vestibular nerve, one of the nerves in your ear that's used for balance. It's usually caused by a viral infection. The symptoms of vestibular neuritis often get better without treatment over several weeks. However, you may need to rest in bed if your symptoms are severe. See your doctor if your symptoms get worse or don't start to improve after a week. You may find your balance is particularly affected if you drink alcohol, are tired, or have another illness. Avoiding these can help to improve your condition. Vestibular neuritis can also be treated with vestibular rehabilitation and medication. Benign paroxysmal positional vertigo, BPPV. Like vestibular neuritis, benign paroxysmal positional vertigo, BPPV, often clears up without treatment after several weeks or months. It's thought that the small fragments of debris in the ear canal that cause vertigo either dissolve or become lodged in a place where they no longer cause symptoms. BPPV can sometimes recur. Until the symptoms disappear or the condition is treated, you should always get out of bed slowly. Avoid activities that involve looking upwards, such as painting and decorating or looking for something on a high shelf. BPPV can be treated using a procedure called the Epley maneuver. The Epley maneuver involves performing 4 separate head movements. They move the fragments that cause vertigo to a place where they no longer cause symptoms. Epley maneuver. Each head position is held for at least 30 seconds. You may experience some vertigo during the movements. Your symptoms should improve shortly after the Epley maneuver is performed. It may take up to 2 weeks for a complete recovery. Return to your doctor if your symptoms haven't improved after 4 weeks. The Epley maneuver isn't usually a long-term cure and may need to be repeated. If the Epley maneuver doesn't work or if it's not suitable, for example, because you have neck or back problems, you can also try Brant Daroff exercises. These are a series of movements you can do unsupervised at home. Your doctor will need to teach you how to do the exercises. You repeat them 3 or 4 times a day for 2 days in a row. Your symptoms may improve for up to 2 weeks. Your doctor may refer you to a specialist, such as an ear, nose and throat (ENT) specialist if the Epley maneuver doesn't work or can't be performed. If you still have symptoms after 4 weeks. If you have unusual signs or symptoms. In rare cases, where the symptoms of vertigo last for months or years, surgery may be recommended. This may involve blocking one of the fluid-filled canals in your ear. Your ENT specialist can give more advice on this. Meniere's disease. If your vertigo is caused by Meniere's disease, there are a number of treatment options to treat both the vertigo and other symptoms caused by the condition. Possible treatments for Meniere's disease include 1. Dietary advice, particularly a low-salt diet. 2. Medication to treat attacks of Meniere's disease. 3. Medication to prevent attacks of Meniere's disease. 4. Treatment for tinnitus, ringing in your ears, such as sound therapy. It works by reducing the difference between tinnitus sounds and background sounds, to make the tinnitus sounds less intrusive. 5. Treatment for hearing loss, such as using hearing aids. 6. Physiotherapy to deal with balance problems. 7. Treatment for the secondary symptoms of Meniere's disease, such as stress, anxiety and depression. Central vertigo is caused by problems in part of your brain, such as the cerebellum, which is located at the bottom of the brain, or the brainstem, the lower part of the brain that's connected to the spinal cord. Causes of central vertigo include migraines and, less commonly, brain tumors. If your doctor suspects you have central vertigo, they may organize a scan or refer you to a hospital specialist, neurologist or an ENT, ear, nose and throat specialist, or audiovestibular physician. Migraine. Treating your migraine should relieve your vertigo if it's caused by a migraine. Vertigo with an unknown cause. If the cause of your vertigo is unknown, you may be admitted to hospital if 1. You have severe nausea and vomiting, and can't keep fluids down. 2. Your vertigo comes on suddenly and wasn't caused by you changing position. 3. You possibly have central vertigo. 4. You have sudden hearing loss, but it's not thought to be Meniere's disease. Alternatively, you may be referred to a specialist, such as a neurologist, a specialist in treating conditions that affect the nervous system, an ENT specialist, a specialist in conditions that affect the ear, nose or throat, an audiovestibular physician, a specialist in hearing and balance disorders. While waiting to see a specialist, you may be treated with medication. Vestibular rehabilitation, also called vestibular rehabilitation training or VRT, is a form of brain retraining. It involves carrying out a special program of exercises that encourage your brain to adapt to the abnormal messages sent from your ears. During VRT, you keep moving despite feelings of dizziness and vertigo. Your brain should eventually learn to rely on the signals coming from the rest of your body. They include signals from your eyes and legs, rather than the confusing signals coming from your inner ear. By relying on other signals, your brain minimizes any dizziness and helps you to maintain your balance. An audiologist, hearing specialist, or a physiotherapist may provide VRT. Your doctor may be able to refer you for VRT, although it depends on availability in your area. In some cases, it may be possible to use VRT without specialist help. Research has shown that people with some types of vertigo can improve their symptoms using a self-help VRT booklet. However, you should discuss this with your doctor first. Medicines to treat vertigo. Medication can be used to treat episodes of vertigo caused by vestibular neuronitis or Meniere's disease. It may also be used for central vertigo or vertigo with an unknown cause. The medicines are usually prescribed for 3 to 14 days, depending on which condition they're for. The two medicines that are usually prescribed are prochlorperazine and antihistamines. If these medicines are successful in treating your symptoms, you may be advised to take them when you have an episode of vertigo. Medication. In some cases you may be advised to take long-term medication, such as betahistine, for conditions like Meniere's disease. Prochlorperazine can help relieve severe nausea and vomiting associated with vertigo. It works by blocking the effect of a chemical in the brain called dopamine. Prochlorperazine can cause side effects, including tremors, shaking, and abnormal or involuntary body and facial movements. It can also make some people feel sleepy. For the full list of possible side effects, check the patient information leaflet that comes with your medicine. Antihistamines can be used to help relieve less severe nausea, vomiting and vertigo symptoms. They work by blocking the effects of chemical called histamine. Possible antihistamines that may be prescribed include cinnarizine, cyclizine, promethazine dioclate. Like prochlorperazine, antihistamines can also make you feel sleepy. Headaches and an upset stomach are also possible side effects. A medication called betahistine works in a similar way to antihistamines. It has been used to treat Meniere's disease and may also be used for other balance problems. It may have to be taken for a long period of time. The beneficial effects vary from person to person. If you have vertigo, there are some safety issues to consider. For example, you should inform your employer if your job involves operating machinery or climbing ladders. You may be at increased risk of falls. Vertigo could also affect your ability to drive. You should avoid driving if you've recently had episodes of vertigo. There's always a chance that you may have another episode of vertigo while you're driving. It's your legal obligation to inform the driver and vehicle licensing agency about a medical condition that could affect your driving ability. How long does vertigo last? The signs and symptoms of BPPV can come and go, with symptoms commonly lasting less than a minute. In cases of Meniere's disease, an episode of vertigo can last for longer than 20 minutes. Migraine-induced vertigo can last minutes to hours. Vertigo can be caused by many factors, including infections, migraines, injuries, and several other health conditions. Treating the underlying cause of your vertigo is the most effective way to decrease discomfort and provide long-term relief. There are also many home remedies, exercises, and medications that may be beneficial. If you experience vertigo, talk with a doctor to determine the cause and find a treatment plan that works for you.